I'm Dr. Katherine Boas. We're here at Boas Vision Associates with my patient Kelly. Kelly recently completed her vision therapy program with us, and I asked her just to have a little bit of a talk with me about her experience with vision therapy. So Kelly, what got you into vision therapy? How did you hear about it? And what motivated you to start?
Well, I've known for a long time that I have something called convergence insufficiency, but I was told long ago by previous doctors that there was not really much that could be done about it, so that I should just live with it and try to deal with it. So I've done that my whole life and didn't give it too much thought because it's just, the way it always was for me. But then I learned about vision therapy because my son is a patient here, and I began to consider whether it was something that could help me as well. So we had the evaluation and
we pursued it.
And
So so she's known about her diagnosis for a while. But as she said, previous providers didn't have the resources to be able to treat her diagnoses. So when we found her some red flags that shot up during her annual comprehensive exam, I had her back for a visual efficiency evaluation. So that's the evaluation we do to assess candidacy for vision therapy and to be able to come up with diagnoses of patients. And after that evaluation, I found Kelly to have a pretty significant convergence insufficiency, meaning her eyes had a really hard time coming together when looking at something up close. And that will give patients symptoms of double vision and headaches, difficulty with, reading and concentrating, and issues with near tasks. She also had a ocular motor dysfunction, and that's an eye movement disorder. So we got her into our vision therapy program here, and after only 10 sessions, which is really, really impressive, both of those diagnoses, the convergence insufficiency and the ocular motor dysfunction, had completely resolved. So she was a perfect patient. This is a really special case to me. And now what have you noticed after your vision therapy program in your daily life?
So there was actually a very noticeable difference. I wasn't sure what really to expect, but in the past I've had issues with having episodes of double vision where my vision would split into two images just when I was resting or randomly. And that has completely resolved. That does not happen ever anymore, and it was a daily thing for me forever. So that's amazing. And I also noticed that I don't get headaches any longer if I'm looking at something at close range, so it's been amazing.
Yeah, so it's I wanted Kelly to talk about her story because she had a child who was in vision therapy and she was doing everything she could for her son, but we were so fortunate to be able to treat her functional vision deficits that she had been dealing with so long. So these conditions that we are treating with vision therapy don't resolve on their own. So if left untreated, they're going to remain untreated. So there's really no age limit to vision therapy, and Kelly's a perfect example of that. Also a perfect example of what a good patient who's dedicated can achieve in such a short amount of time. So we really do, we really are fortunate to have Kelly and her family here as patients and to share her story. So
I appreciate the help. Thank you.
Yes.